At 72 years of age, James had spent many years believing that waking up 4 or 5 times nightly to use the restroom was simply an unavoidable aspect of growing older. His physician had previously diagnosed him with an enlarged prostate, and James resigned himself to this condition as a reality he was unable to alter. However, what James failed to comprehend was that the true cause of his distress was not solely his prostate anatomy. The actual problem was sitting directly beside his bed inside a small orange medication container. Like millions of other older adults across America, James consumes several prescription drugs every day. He takes one pill for hypertension, another to manage his allergies, and occasionally a painkiller to soothe the arthritis in his joints. He never once doubted these treatments because they were either authorized by his medical providers or purchased freely at the local pharmacy. Yet, what remained unknown to him is that some of these very therapies can silently aggravate existing prostate issues. James is certainly not unique in this struggle, as the National Institutes of Health reports that over half of men exceeding age 60 manage symptoms associated with prostate enlargement. These symptoms include needing to urinate frequently, difficulty starting or stopping the flow, a weak stream, or rising multiple times throughout the night. Here lies the concealed reality, which is that in numerous instances, the cause is not merely advanced age, but rather the adverse effects of routine drugs taken by millions daily. Consider whether you have ever observed your symptoms intensifying after commencing a new prescription, or noticed that your nighttime bathroom visits increased despite watching your fluid intake. This occurs because specific medications, ranging from common allergy tablets to blood pressure treatments and even ordinary painkillers, can interfere with bladder muscles, tighten prostate tissues, or disrupt the nerves governing urination. The most alarming aspect is that the majority of seniors possess no knowledge that this connection even exists. They endure their discomfort without complaint, convinced it is just a natural result of aging, while the very pills they trust for their heart, sleep, or allergies are quietly stealing their rest and dignity. In this presentation, we intend to uncover the 9 most prevalent medications that might be unknowingly damaging your prostate health. Some of these will likely astonish you because they are pharmaceuticals that almost every household in the United States maintains in their cabinet. Let us commence with the most frequent category of drug, which are diuretics, commonly referred to as water pills. If you suffer from hypertension, heart failure, or edema in your lower limbs, there is a high probability you have been prescribed a diuretic. According to the Centers for Disease Control and Prevention, over 40% of Americans past the age of 60 utilize some variation of this drug daily to manage cardiovascular conditions. These tablets function by assisting your kidneys in eliminating excess sodium and water from your system. This process results in reduced fluid volume in your bloodstream, decreased strain on your heart, and diminished swelling in your ankles and feet. Superficially, this appears to be a life-preserving treatment, and in many specific scenarios, it absolutely is. However, this is where the concealed difficulty originates, because diuretics compel your body to generate larger quantities of urine, which drastically raises the frequency of urination. For a man dealing with an enlarged prostate, that additional physiological demand can feel entirely unmanageable. The prostate gland is already constricting the urinary tract, decelerating the flow, and producing a sensation that the bladder has not completely emptied. When you introduce the urgency caused by a diuretic, the outcome is incessant journeys to the restroom, particularly during the nighttime hours. Scientific research supports this, as a study in BJU International monitored over 2,000 men past age 65 and discovered that those using diuretics were 28% more prone to nocturia. Another report from the American Journal of Kidney Diseases indicated that diuretic users experienced up to 3 times higher incidences of severe nighttime urinary issues, such as urgency and a weak stream. Consider the practical implications of this, as every additional voyage to the lavatory at 2 or 4 in the morning represents more than just a nuisance for older adults. According to the National Institute on Aging, falls rank as a primary cause of injury for men over 70, and many such accidents occur during these late-night bathroom excursions. Therefore, a pharmaceutical intended to safeguard your heart might silently be jeopardizing both your prostate health and your physical safety. James, the individual we discussed previously, failed to understand that this specific scenario was unfolding in his own life. His cardiologist had ordered a diuretic to maintain his blood pressure within a safe range, but his sleep was soon fragmented into brief, agitated intervals. He attributed his struggles to his aging prostate until he discovered that the tablet he swallowed every evening was exacerbating the issue. The remedy is not to cease your medication, as diuretics can be vital for averting heart attacks and strokes, but rather to consult a doctor about adjusting the schedule. Physicians often suggest taking the pill in the morning or early afternoon, so the effects dissipate before bedtime, or switching to other blood pressure drugs like ACE inhibitors. The fundamental lesson is that if you are waking frequently at night while on a diuretic, do not presume it is solely your prostate, as your medication could be a factor. Now let us proceed to the second category of drugs that frequently escapes detection, which are antihistamines, the tablets millions of Americans utilize during allergy season. If you have ever consumed diphenhydramine for irritated eyes, chlorpheniramine for nasal congestion, or specific sleep aids utilizing these ingredients, you have felt an antihistamine inaction. These drugs inhibit histamine, the chemical your body discharges during allergic responses, resulting in reduced sneezing, alleviated itching, and improved sleep quality. While that sounds like relief, for aging men and particularly those with prostate enlargement, antihistamines can precipitate severe urinary complications. This occurs because antihistamines do not merely dry your nasal passages, but also obstruct specific nerve transmissions in the bladder and prostate region. This action relaxes certain muscles, yet regrettably, it also enfeebles the bladder's contraction and tightens the sphincter surrounding the urethra. The consequence is that urine becomes obstructed, and suddenly you find yourself straining to begin, stopping midway, or feeling unable to fully void your bladder. A study featured in the Journal of Urology discovered that men over 65 who routinely used first-generation antihistamines faced a 45% greater risk of acute urinary retention. Another analysis from Harvard Medical School highlighted that older adults utilizing these drugs were twice as likely to endure nighttime urinary symptoms like urgency and diminished flow. Simply stated, the tablet you ingest to achieve better sleep might be the exact cause of your waking at 3 in the morning, struggling to urinate. James, the 72-year-old gentleman we referenced earlier, discovered this difficult truth through personal experience. In addition to his blood pressure treatment, he frequently consumed an over-the-counter sleep aid containing diphenhydramine to help him rest. Rather than providing him with peaceful nights, the medication exacerbated his prostate symptoms, compelling him to visit the bathroom more frequently and with increased difficulty. This narrative is one that many seniors understand well, as allergy pills and sleep aids appear innocuous because they are obtainable without a prescription. The fortunate news is that newer antihistamines like loratadine or fexofenadine are engineered to address allergies without impacting the bladder's nervous system as severely. If you utilize antihistamines for sleep, it is beneficial to discuss safer alternatives with your physician, such as enhancing sleep hygiene or attempting melatonin. We shall now discuss decongestants, the tablets or liquids people consume to manage colds, the flu, or severe sinus congestion. If you have ever purchased a cold remedy at a drugstore, you have likely observed names like pseudoephedrine or phenylephrine printed on the package. These active ingredients are found in numerous popular multi-symptom cold medications and function by constricting swollen blood vessels located within your nasal passages. However, the concealed issue is that they do not solely affect your nose, but also stimulate other smooth muscles throughout your body, including those surrounding the bladder. This stimulation causes the muscles encircling the urethra to contract, making it significantly more arduous for urine to pass through. For men possessing enlarged prostates, this effect is comparable to applying an additional clamp to a passageway that is already narrow. Suddenly, the act of urination becomes slow, laborious, or even impossible, and the associated medical risks are quite genuine. A clinical review in the Mayo Clinic proceedings determined that decongestants substantially raise the probability of acute urinary retention in men exceeding 60 years of age. Another investigation in the Journal of Family Practice stated that men over 65 utilizing pseudoephedrine medicines saw nearly a twofold rise in urinary retention incidence. This condition is not merely uncomfortable, but dangerous, as acute retention implies a total inability to urinate, which necessitates emergency catheterization. James once contracted a winter cold and chose to take a sinus tablet available over the counter to treat his symptoms. Within a few hours, he experienced intense pressure in his lower abdomen and faced extreme difficulty in initiating his urine stream. For men with enlarged prostates, these pills can shift the situation from annoying symptoms to a genuine medical emergency. The safest approach is to avoid oral decongestants when feasible, and instead consider saline sprays or humidifiers that function locally without tightening bladder muscles. Next on our list are sedatives and sleeping pills, which are medications that many seniors depend upon when battling insomnia or anxiety. According to the National Sleep Foundation, nearly half of adults over 65 report trouble sleeping, leading many to prescribed benzodiazepines or other sleep aids. While these tablets appear to offer necessary rest by calming the nervous system, they carry a hidden cost regarding urinary function. Sedatives relax the mind, but they simultaneously relax the muscles responsible for controlling urination. For a man with an enlarged prostate, this creates a hazardous combination where the bladder loses its natural tone and struggles to contract effectively. Concurrently, the urethral sphincter may not open efficiently, resulting in incomplete emptying, a weak stream, and more frequent nighttime visits to the bathroom. Research published in the Journal of the American Geriatric Society found that older men taking benzodiazepines were significantly more likely to develop urinary tract symptoms. Another study reported that long-term users of sleeping pills experienced much higher rates of nocturia and incontinence, with risks being especially high for men with prostate enlargement. Furthermore, because sedatives induce drowsiness and impair balance, every trip to the bathroom in the dark becomes increasingly dangerous. The National Institute on Aging has cautioned that seniors on sleep medications face a 50% greater risk of falls and fractures. James turned to a prescription sleep aid after weeks of restlessness, but he soon noticed that his bladder never seemed completely empty. He found himself waking twice as often and shuffling unsteadily to the bathroom, nearly slipping on his return to bed one night. Instead of restoring his energy, the medication deepened his exhaustion and introduced new safety risks to his nightly routine. Doctors often recommend non-drug strategies first, such as maintaining a consistent bedtime or practicing relaxation techniques, before prescribing medication. If pills are necessary, discuss options with your doctor that have fewer effects on urinary function, such as low-dose melatonin. We now arrive at a group of medications that many older adults know well, which are opioid painkillers. Names like oxycodone, hydrocodone, and codeine are familiar because they are frequently prescribed for chronic back pain, arthritis, or post-surgical recovery. For many seniors, these drugs feel like a lifeline because they dull severe pain and make daily movement possible. However, opioids act on the central nervous system to block pain signals, and in doing so, they interfere with the nerves controlling the bladder. Specifically, they suppress the reflexes required for bladder contraction, while simultaneously increasing the tone of the urinary sphincter. The result is a dangerous mix of urine retention, weak flow, and frequent urges that never result in satisfaction. A study in the British Journal of Anesthesia found that nearly a quarter of men given opioids after surgery developed acute urinary retention. Another study reported that men over 60 on long-term opioid therapy were 40% more likely to develop lower urinary tract symptoms compared to non-users. Acute urinary retention is not only painful, but can also cause kidney damage if it remains untreated for too long. James was prescribed hydrocodone for chronic back pain after a fall, but within weeks, he found it increasingly difficult to start urinating. One night, the pain from a distended bladder forced him to the emergency room, where doctors explained that the opioids were partially responsible. If opioids are absolutely necessary, doctors can monitor bladder health or adjust dosages to minimize these risks. Now let us turn to another class of drugs found in almost every medicine cabinet, which are non-steroidal anti-inflammatory drugs, or NSAIDs. These include familiar names like ibuprofen and naproxen, which millions of seniors use as the primary solution for aching joints and arthritis. Surveys estimate that over half of adults over 65 use NSAIDs regularly, believing them to be harmless pain relievers. However, long-term and frequent use has been linked to changes in hormone balance and an increased risk of prostate complications. Some studies suggest that chronic use can alter levels of prostaglandins, which play a role in inflammation and prostate cell growth. Over time, this may contribute to benign prostatic hyperplasia and worsen urinary symptoms like frequency, urgency, and a weak stream. A large study in the American Journal of Epidemiology followed thousands of men and found that regular NSAID users were 27% more likely to report urinary tract symptoms. Another report noted that chronic users had significantly higher prostate volume and an increased risk of moderate to severe symptoms. James frequently took ibuprofen for the arthritis in his knees, sometimes consuming multiple doses a day to keep the pain in check. When his urologist reviewed his medication list, he pointed out that years of NSAID use could be quietly fueling his prostate problems. The answer is not to banish these drugs entirely, as they are useful for occasional pain, but moderation is essential. Seniors with prostate problems should limit long-term daily use and explore alternative pain management strategies like acetaminophen or physical therapy. The bottom line is that what seems like a harmless pain reliever can quietly fuel prostate growth if used too frequently. We now come to a group of medications that tens of millions of Americans over 60 take every single day, known as statins. These include common drugs like simvastatin and atorvastatin, which are prescribed to lower cholesterol and reduce the risk of heart attacks. While statins protect the heart, they can also influence hormone balance in ways that may affect the prostate gland. Cholesterol is a building block for important hormones, including testosterone, so lowering it dramatically can sometimes lower testosterone levels as well. For older men, this can disrupt the delicate balance that supports prostate and urinary health. A study in the Journal of Clinical Oncology found that men on long-term statin therapy had a 26% higher risk of developing urinary symptoms. Another study reported that older men on statins had a greater likelihood of reporting erectile dysfunction and urinary difficulties. For James, statins became another layer of complication as he began noticing not just urinary frequency, but also fatigue and vitality loss. When he spoke with his urologist, he learned that statins might be lowering his testosterone and subtly contributing to his prostate issues. The answer is not to stop statins altogether, as they significantly reduce cardiovascular risks, but to work closely with a doctor. Men should monitor prostate symptoms and ask about alternatives or lifestyle changes that can support natural hormone balance. The goal is not to fear these medications, but to be aware of their impact and find the right balance for your health. Finally, we reach the 9th group of medications that can affect prostate health, which includes hormone therapy and testosterone supplements. As men age, testosterone levels naturally decline, leading many to seek replacement therapies to restore energy and sexual health. However, the hidden catch is that testosterone directly fuels the growth of prostate tissue, which is highly sensitive to these hormones. When testosterone levels rise, the prostate often enlarges, and for men who already have benign prostatic hyperplasia, this can worsen symptoms. A clinical trial found that older men receiving testosterone therapy had a significantly higher increase in prostate volume compared to others. Another long-term study showed that men on testosterone replacement were twice as likely to require medical treatment for urinary obstruction within 5 years. While the link to cancer is debated, elevated androgen levels can stimulate the growth of hidden prostate tumors in vulnerable men. James was offered testosterone gel by a friend to help with fatigue, and for a few months, he felt stronger. However, his urinary symptoms soon worsened dramatically, forcing him to wake up 6 or 7 times each night. His doctor explained that the extra testosterone was enlarging his prostate even further, meaning the perceived miracle cure had backfired. Testosterone therapy is not inherently bad, but it must be closely supervised by a physician who screens for prostate risks. For men looking to support testosterone naturally, lifestyle factors like resistance training and maintaining a healthy weight play a huge role. So there you have the 9 most common medications that may be silently affecting your prostate health. From water pills for blood pressure to allergy medicines and pain relievers, each has the potential to worsen urinary symptoms. The important message here is not to live in fear or to discard your necessary prescriptions without consultation. Many of these medications save lives, so the real key is awareness and having open conversations with your medical provider. Knowing the side effects gives you the power to ask the right questions and make adjustments that protect your quality of life. If you have noticed more bathroom trips or a weaker stream, do not just accept it as a normal part of aging. Bring these issues up with your physician, because small changes in dosage or drug selection can make a world of difference. Remember that your health is about the whole picture, with your heart, brain, and prostate all working together.